So, good day and a very warm welcome to the Joe webinar on Auscultation in Action, teaching cardiopulmonary dynamics. I'm Dr. Stephen John, a scientific outreach specialist, and I'll guide you through today's session. And joining me today is Dr. Lakshmi, who will be monitoring the chat box to ensure no questions are missed. Before we begin, let's cover some housekeeping items. You can use the chat and the Q&A features to send in your questions anytime. Closed captions are also available for a more inclusive experience. So today's session focuses on using innovative tools to teach and understand cardiopulmonary dynamics more effectively. This webinar is all about discussion and exchanging ideas, so don't hesitate to jump in. So here is a quick overview of what we'll cover. So first, we'll dive into the challenges educators face when teaching cardiopulmonary dynamics. Next, we'll shift our focus to the struggles students encounter when learning these complex concepts. Following that, we'll introduce Joe Solutions, a suite of innovative tools and content that support teaching complex topics. Finally, we'll wrap up with a live Q&A session. All right. So before we begin, let's explore how Joe can truly be a game changer. So in understanding complex topics, say specifically on cardiopulmonary dynamics. So you have a text article here and a video. So consider the case of a 17-year-old patient with congenital transposition of the great artery, so CCTGA as an example. Reading the detailed explanation gives you all the important clinical insights, but the complexities of the heart failure, abnormal cardiac anatomy, and also the artificial heart implantation might remain abstract and also difficult to visualize for many learners. Now imagine a video. So here we have a video. I'll place some glimpses of it.
This video summarizes a modified procedure used to implant a total artificial heart in a patient with a history of congenitally corrected transposition of the great arteries, pulmonary atresia, and ventricular septal defect. Complete decompression of the heart. The aorta and the main pulmonary artery were then divided. After dissecting the rest of the ventricular surface, the main pulmonary artery, the pulmonary artery branch, and the proximal pulmonary artery branches, the right ventricle was dissected out.
So as you can see, what difference it can make. So first is visualization in action. You can see how the heart, showing the malformed heart, the surgical modifications are clearly shown, and then it's also helpful for understanding. So viewers could see how the abnormal arrangement of the ventricles and the specific adjustments. So you can always watch this video. It has, you can go to www.joe.com and you can put the title, Implantation of Total Artificial Heart in Congenital Heart Disease. So yeah, that's what we bring in. Joe bridges the gap between words and comprehension by showing processes as they happen. So students can understand these complex concepts. So the abstract becomes tangible and complex becomes clear. So now let's move into our next area of discussion. So why are certain cardiopulmonary topics difficult to teach? So as you know, teaching cardiopulmonary dynamics comes with unique challenges. For example, abstract concepts like auscultation sounds and airflow mechanics can be difficult to describe verbally and also with static diagrams. So that's one certainly a challenge for, say, educators. And number two, engagement can be a hurdle. When students can't visualize, they cannot connect to the anatomy and functions in real time. And also we have another challenge, which is retention. So when it comes to retentions, like terms like bronchial breath sounds versus vesicular breath sounds, they often require multiple repetitions without interactive methods. So Joe addresses these issues by combining the scientific accuracy with engaging visuals. So now let's look at some of the common student struggles. So from the student perspective, here are some struggles. So first is time constraint. So the medical students, especially like ones who have to do like clinical rotations, they have a packed schedule. So it's hard to dedicate extra time to grasp complex concepts. And then also they have just a static learning material. So textbooks, 2D diagrams, you cannot replicate the real dynamics of cardiopulmonary functions. As I mentioned earlier, retention is a big issue. So many students struggle to remember theoretical content with visual examples. And another big barrier is the language. For non-native speakers, scientific terminology can be daunting. So Joe, visual and interactive resources directly addresses these challenges by offering a multimodal approach. So it's easier to understand all these complex concepts. Now let's understand the idea behind Joe. So it's all down to visualization. So you have a complex concept and you have to understand and you have to conduct, say, studies. So the idea behind Joe is simple. Visualizing concepts through video enhances understanding compared to reading alone. So, and in fact, scientifically proven that visual stimulation leads to better understanding. Imagine trying to understand how breath sounds correlate with physiological states without hearing them, or trying to visualize airflow obstruction in chronic, say, chronic obstructive pulmonary disease with just a textbook diagram. As you can see, you cannot visualize, you cannot really understand the functions. So at Joe, we bring these concepts to life with videos demonstrating number one, real-time auscultation techniques, say simulated airflow dynamics in healthy versus disease state, and hands-on demonstration of diagnostic procedures like echocardiography. I'll show you a couple of videos in some time. So where are we today as Joe? So we have over 18,000 videos in our growing library. So I'd like to call it growing because we have 500 plus videos published every year with over 1,000 subscribers and over 8 million users. We have videos available in 14 different languages, and we have videos with 10 plus languages, subtitles in 10 plus languages, and all of these can be accessed 24/7. So now I'd like to tell you how Joe supports teaching and learning. So number one, it simplifies concepts, so explanation. So our videos break down auscultation and related processes into, say, smaller manageable steps. And number two is it enhances comprehension and retention. So as I mentioned earlier, there are concepts which are difficult to say visualize and memorize. So we help students move beyond memorization to leads to deeper comprehension. So we focus on empowering them and apply these ideas, what they visualize into their professional journeys. And the next is we have formative assessment. So Joe provides pre-made quizzes for each video. So I'll show you how you can embed a video and like how it can be used to develop quizzes. So you can use them to check your students' understanding or as a discussion starters for in your classroom. So the next is appealing to different learning styles. So when it comes to a mix of visuals and narrations, our videos can be catered to both visual and auditory learners. So ensuring all students can grasp the material. And most important thing is it saves your preparation time. So when you're busy looking to find materials to teach, Joe's ready-to-use resources helps you to find materials at ease. So time for searching for supplementary materials and more time focusing on your teaching. So that's how it helps. So the last thing is seamless LMS integration. So when I talk about LMS integrations, we have it can be say integrated into any platforms like Blackboard, Moodle, and also Canvas. So that's how Joe really supports not just the say, educators like faculty, but also students to get their materials already in hand before they even begin their classes. So that's something which will be very handy for students and say professors to use and get ready to do their teaching. So now let's uh, go to our website and let's explore what features are there. And also we can see a couple of videos and how it can be used or how they align to your curriculum. So before I go in, I'd like to tell a bit more about our, say, core collection. So let me take you to the website. Yeah. When you come to our website, you can simply type www.joe.com. It has two main sections, so research and education. So, of course, research is focused on advanced techniques. So you can go to, let's say, medicine, and you can find various methods published as articles. So these are video articles where it focuses heavily on the methods and how it can be, say, used. And the next is our education collection. So under education, we have clinical and core. So if you go to core, you'll find all the various subjects here. So let me take you through, say, anatomy and physiology. So here is our anatomy and physiology collection. So you can see there are 31 chapters. So it has about 646 short video lessons. So these videos are approximately 90 seconds and it's one concept, one video. So it can also be used for real-time practical application. So it's tailored for undergraduate courses for health sciences. So it'll be very handy. So now let me take you to a video where I'll show you an example. So here's an example showing correlation between, say, ECG and cardiac cycle.
The electrical signals recorded on an electrocardiogram, or ECG, occur before the mechanical processes of systole and diastole during the cardiac cycle. The P wave signifies the spread of cardiac action potential from the sinoatrial node to the atrial contractile cells. Approximately 0.1 seconds post the P wave, atrial systole begins, lasting until the PQ interval. About 0.2 seconds after the P wave, the QRS complex shows up, indicating that the cardiac potential has reached the ventricular contractile cells, moving down the septum to the apex, then upwards. The ventricular systole begins after the QRS complex, spanning the entire ST interval. Simultaneously, the atria return to diastole. Next, 0.4 seconds after the P wave, the T wave emerges, signifying ventricular repolarization. Shortly after the T wave, the ventricles begin to relax. By 0.6 seconds, the ventricles are completely relaxed. The next 0.2 seconds mark a brief period where both the atria and ventricles are relaxed. Another P wave appears at 0.8 seconds, initiating atrial contraction and restarting the cycle.
All right, so you can see how it enhances the understanding of anatomical structures and physiological processes. So let me show you another video where it's on chronic obstructive pulmonary disease.
Chronic obstructive pulmonary disease, or COPD, is defined as a diverse lung condition marked by persistent and progressive respiratory symptoms such as dyspnea, cough, and sputum production, caused by airflow limitations and abnormalities in the airways. COPD may result due to conditions such as bronchitis and emphysema. Emphysema involves the permanent enlargement of the alveoli and destruction of their walls, leading to loss of lung elasticity. These patients typically feel tired as breathing consumes a lot of energy. They may develop a barrel chest and flattened diaphragm as a result of air trapping, impairing ventilation. In chronic bronchitis, inflammation of the bronchial tubes leads to excessive mucus production and fibrosis in the lower respiratory passageways. These patients develop a high risk of frequent pulmonary infections due to mucus buildup. The primary environmental factors that contribute to COPD include smoking tobacco and breathing in harmful particles and gases from air pollution. COPD treatment typically involves inhaled bronchodilators and corticosteroids. Oxygen therapy is recommended for severe dyspnea and hypoxia.
All right, again, how these visual representation helps students to grasp abstract ideas. So that's how Joe really helps to understand these concepts. Not just that, they can also apply these in clinical settings. So let me show you a video from our medical surgical nursing collection. So this is specifically focused on, say, educators who are more into like, say, clinical settings. So if I go to medical surgical nursing, we have almost 14 chapters. So I'll take you through, so cardiovascular diagnostic studies. So let's we watch imaging studies for cardiovascular system, echocardiography.
Echocardiography uses ultrasound waves to capture heart images called echocardiograms. It diagnoses heart failure and valve disorders, and assesses cardiac structures and ventricular wall motion. Before the procedure, the nurse explains the procedure to the patient, and asks them to change into a hospital gown. Next, the patient is instructed to lie supine on the examination table. The cardiac sonographer then applies conductive gel over the patient's chest and places a transducer at the second and fourth intercostal spaces to the left of the sternum. The transducer is then turned clockwise or counterclockwise, while emitting high-frequency sound waves that bounce off heart structures and return to the transducer. The patient may also be asked to turn and lie on their left side, while the cardiac sonographer adjusts the transducer's angle to capture different heart views, such as parasternal and apical views. A computer converts these sound waves into visual images displayed on a monitor. After the procedure, the cardiac sonographer wipes the gel off the patient's skin and monitors for symptoms like chest pain.
All right, so you can clearly see how video lessons and animations play a vital role in teaching, say, anatomy and physiology, and also for any processes to improve the knowledge in clinical settings. So you can explore our website. So as I mentioned, I'll show you what collections we have. So as I mentioned, if you go to clinical, you'll find, say, nursing, pharmacology, science education, clinical, and also anatomy and physiology. So under that, we have, say, 31 chapters, as I mentioned earlier, on various systems. So you can access these videos. It's 90 seconds in length, and it's very so easy to integrate. So as I mentioned earlier, we can create quizzes. We have subtitles in 14 different languages. You can share the video with your students. You can save it, and you can also find all the videos which are relevant to these topics. So it's easy to embed, and it's also, you can find the transcript, which is very helpful for students to uh, read and understand as well. So apart from the education collection, we also have the research section here. Under that, we have our Joe Journal and Joe Encyclopedia of Experiments, which are procedures conducted on, say, animals. So we also have our Faculty Resource Center, which should be very helpful. So we have books which are already mapped. Uh, so if I go to clinical, you'll find books on anatomy and physiology. So example, you have the Harper's Biochemistry, you have the Head and Neck Anatomy, and Ganong's Medical Physiology. So you have all these books already mapped with all the chapters. So yeah, feel free to explore our website and find you'll find content relating to what you teach. So now let me open the floor for any questions.
Thank you, Stephen. So we have a couple of questions.
Sure.
Yeah. So the first question for you today is, can Jove cover more advanced topics than
Yes.
what we just discussed today?
Yeah, absolutely. So as I mentioned, we have say starting from basics, we have videos focusing on advanced techniques. So when it comes to any complex topics, you can always go to our science education collection. So under which we have clinical skills. So these videos say focus on all the exams, nursing skills, even critical care. So you have to give life support and various complex procedures. So all these advanced, say, concepts and topics are covered here. And also we have the research where you can go and find methods which are, say, complex to perform.
Thank you, Stephen. And the next question is about tracking the student engagement. So the question goes as, is there a way to track the student engagement with the Jove videos?
Absolutely. So as I mentioned earlier, if you go to a specific video, you have the quiz feature. So when you add the quiz feature, you can also find the number of questions answered, the number of questions which were there on the list, and you can also find the scores, and you can also download it as a CSV file, and you can do say analyze the data, and you can always do all that. So it's very easy, and it's also convenient for any faculty to use these say features.
And we have another question coming up regarding the pricing to access these materials.
Right. Yeah, so pricing, it's based on what bundle you choose. So currently we have, say, different options. Like if you want to focus on, say, just the clinical side, like say if you're teaching nursing. So if you just want that bundle, it's one price. But if you want on the whole, like core anatomy and physiology, also the nursing and science education, that's a different price. So I think the best advice here would be yeah, let us know what you need, and our sales rep will contact you and give you all the details so that it'll be very helpful.
Yeah. And the last question for today, Stephen, is, can students access these videos, the Jove videos, outside the classrooms?
Yes, absolutely. So Joe Videos, as I mentioned, is accessible online 24/7. So students can review their content on their own pace outside the class once they get their, say, IDs. And also they can save videos and they can watch it anytime they want. So it's a super handy tool. So it'll be very helpful for anyone to use outside the class.
Thank you, Stephen. So that's all the questions that we have for today.
All right. Yeah, thank you for joining today's session. We hope you gained valuable insights into teaching cardiopulmonary dynamics more effectively. So for more information or to request trial access or any questions you might have, visit our website or contact us directly. Yeah, thank you. Have a great day.